Hi, I'm Jocelyn Olivier, and I wanted to introduce you today to this tool that we created as a follow-up exercise system for after reprogramming your hips and low back. And for years, I've just told people, get a couple of tennis balls and put them in an old sock, and we'll give you a handout, which we still are happy to do. But sometimes people can't quite remember exactly what we showed them, so we did create a DVD with an actual step-by-step in it, illustrating what it is that you want to do. Problems with the low back start with things like getting too short on one side, having the extensor muscle stop working such that your back no longer tips, or getting a torque in the middle here at the base of the ribs, such that when you should be alternating and rotating and doing activities that your pivot doesn't work well. So the idea that you could do something on your own is where this comes from. The idea that you could actually use a tool as simple as this, 2 tennis balls in a sock. This one is an indestructible sock with indestructible balls. It will last for the rest of your life. And you start off on a routine to reprogram. So you start by reprogramming the pivot in the middle of your back. You put the balls right here, and they're right next to each other on either side of your spine. And the second step on this is to take the balls, which are movable inside their space, so that you can work with them on your sacrum right here. And you're going to be going through a series of movements to use the balls as a way to work with the external rotator muscles here on the hip as it attaches to your sacrum, and cause them to soften, which gives you a lot more space. And once you have some space in your hip, your back extensors can then work. Otherwise, if you're trying to tip your tailbone back, the tightness in the back of your external rotators is going to stop you from being able to engage the extensors in the lower back. So the third thing we do is we put those balls together again in this sock. We put the balls here, we're lying on our back with our knees up, and we tip our tailbone back and we learn to articulate. This can also be done using the wall for a background, and you can do it standing. So this is the series of things that we do when we're teaching our body how to regain the control of the individual muscles that haven't been able to work once we've turned them back on using neuromuscular reprogramming. And there's a couple of other things that go with this series, but it's an important series to have a sequence for re-educating your body after you do your neuromuscular reprogramming. So these are available for sale. Actually, a practitioner could have them for sale in their own treatment facility. Once they've done their corrections with their clients, they could sell them.